Hi, this is Mark Van with my short summary video on the hidden sources of dietary inflammation. All chronic disease is characterized by an ongoing stimulation of inflammation. This video provides the foundational knowledge of common dietary sources of inflammation. Think of it as your basic skills in trying to normalize your inflammatory expression. For those of you not familiar with the inflammatory response, inflammation is a complex local immune response to tissue injury. The end goal of inflammation is to restore the damaged tissue. Characteristics of inflammation include pain, redness, heat, swelling, and loss of function. Multiple factors commonly stimulate chronic pain. For example, a chronic headache may reduce sleep and activity levels. Both of these factors are crucial at reducing chronic pain in the future. As chronic pain levels worsen, so does the sleep quality and exercise levels. This becomes a sinkhole of continued pain, making it more difficult to end the cycle. A toxin is any substance that damages tissue. Even natural substances can cause tissue damage in high doses. There are two basic dietary toxins to be aware of: industrial seed oils and refined sugars. While in small amounts, these substances may not be harmful. As you will see, we are not currently eating refined sugars and seed oils in low to moderate amounts. We consume well above the recommended amount of daily sugar intake from the combined effects of food and beverage sweetened products. Toxicity is affected by the rate of absorption, and sweetened beverages will absorb more quickly than sweet foods. Besides the clear connection between sugar intake and diabetic diseases, sugar overconsumption has a connection with a myriad of other conditions. For example, excessive sugar also impacts the gastrointestinal tract and can increase the risk of Crohn's disease and ulcerative colitis. Industrial seed oils have been introduced into the human diet recently. Seed oils are rich in the omega-6 fat linoleic acid. While consumption of linoleic acid is nothing new, anthropological research suggests humans consumed omega-3 and omega-6 oils in a 1-to-1 ratio. The average American currently overconsumes omega-6 in a 10-to-1 ratio. This is a drastic increase in the amount of linoleic acid consumption. What is the overall impact of increasing omega-6 fat consumption by 10? The ratio of omega fats has been demonstrated to be protective against chronic degenerative diseases. The divergence from this ratio has been associated with an increase in all inflammatory disease, with the best research pointing to an increased risk of cardiovascular disease and depression. A major aspect to chronic inflammation is chronic pain. Unfortunately, chronic pain in the United States affects more people than diabetes, heart disease, and cancer combined. With the rise in chronic pain, opioid drug use for chronic pain has also increased. This has led to an increase in opioid addiction-related deaths. The burden of chronic disease treatment cannot fall on the pharmaceutical industry alone, especially since we see major societal contributions to chronic inflammation and pain that are not deficiencies in drugs but rather food toxins. I hope that this short video was able to give you two basic areas of focus that can help you reduce your overall inflammation through simple lifestyle modification. A quick blurb about myself. I have my doctorate in acupuncture with a focus on integrative medicine, and my practice focuses on both functional and traditional medicine. At our office, we help patients with chronic disease. This includes the treatment of chronic pain and reoccurring mysterious chronic conditions. If you are suffering from a chronic condition, please consider seeing me at my private office, the Turco Chiropractic Group.